Hi everyone, this is Professor Mochner and I'm going to be talking about bladder catheterization today. Just wanted to make you aware there are a couple different types of catheters. There's an indwelling catheter which allows you to drain the bladder for an extended period of time. An intermittent catheter, also known as a straight or in and out cath, and that's exactly what it allows you to do. Go in, drain the bladder, and come right back out. And then although we won't be covering them in lab, an external catheter is available for both males and females, and I just wanted to make you aware of those. So what are the indications for placing an indwelling catheter? Excuse me. It allows you to monitor urine output of a patient, can provide relief of urinary retention by just draining the bladder. If a patient has maybe had a spinal cord or brain injury, or if they have maybe a neurological condition like MS, where the bladder can become very flaccid or spastic and not work properly, can give the patient some relief by not having to get up all the time. Also, the same goes true for an immobilized patient or someone who has a total incontinence. Also, if a patient is going into surgery or post-operative, it allows the practitioner to drain the bladder when the patient is otherwise unable to get up. So what are the indications for a straight or intermittent catheter? Probably one of the most common reasons we use it is just to obtain a sterile urine sample. If a patient needs bladder irrigation, maybe following bladder surgery or prostate surgery, it allows the ability to just go in, irrigate the bladder, and come right back out. Or if a provider needs to administer contrast for certain radiological studies. So contraindications of bladder catheterization can be history of a urethral stricture or if a patient has urethral trauma. So if you suspect blood at the urethral meatus, then you need to avoid catheterization through the urethra. And also if you see a hematoma or bruising of the perineum or scrotal region. In these cases, you might have to do a suprapubic catheterization, which would be a different lecture. So what relative contraindications might be, if you already know the patient has an acute UTI, there's no need in possibly introducing more bacteria into the bladder. Also, if a patient is on anticoagulants, the risk of trauma to the urethra and bleeding into the urethra is a possibility. So complications, an allergic reaction can occur from the iodine used to clean. So make sure you ask if anyone has betadine or iodine allergies. Also, many catheters are made out of latex, and so they can have a reaction to that. Patients who have prolonged indwelling catheters are actually a little more prone to producing bladder stones. Due to injury of the urethra, blood in the urine can be a complication as well. And kidney damage can occur with long-term catheters, as well as septicemia, which is infection into the urinary tract, kidneys, or even into the blood. So when I was first out of PA school and was asked to catheterize someone, I was very overwhelmed with what size do I use, what kind do I use. And so just kind of a rule of thumb for females, a 14 to 16 French Foley is common. And for males, a 16 to 18 French. So keep in mind other factors may play a role in deciding the style and size of what kind of catheter you're going to use. So on a Foley, how much saline do I insert to fill out the balloon? to fill up the balloon was another question that I had, and the nurses just seemed to miraculously know this. I later found that it was no secret at all. If you'll notice on this Foley catheter with the orange tip, that is a 16 French, that's indicated there. And then underneath it, it says 10 cc's. That's letting you know how much saline to insert into the little orange tip on that particular catheter to help fill the balloon. On the one with the green tip, that is a 14 French, and also requires 10 cc's to fill the balloon, and that would be inserted through the little green port there. So catheter-associated urinary tract infections are referred to as CAUTIs, and they are the leading cause of healthcare-induced infections. So please, please, please don't be that practitioner who gives their patient an infection. So the next thing we want to talk about are the supplies needed for the actual procedure.
So first I want to talk about cleaning the area before you start your procedure. This is called peri-care, and if you forget this step and you're in a hospital setting, the nurses will have your head. So they'll typically give you some warm soapy water, take either some type of cotton swab, a cotton ball, or an applicator, and you'll just dip it in water. And when you clean the area, you'll clean the side farthest from you first, and it goes straight down from the clitoral hood all the way down to the anus in one direct swoop. And then you'll get some more hot water, soapy water, and go to the other side in one complete swoop. Again, and then straight down the middle from the clitoral hood all the way down to the anus. Okay? If you're doing a catheterization on a male, you'll take your cotton ball, cotton swab, or foam device, put it again in the warm soapy water, and you'll start at the meatus and work your way all the way around the penis. Okay? This is kind of your pre-wash before you start your procedure, and that is required. All right, so let's talk about what's in your kit. First, your kit will have a sterile container for urine collection. You'll typically have some sterile gloves. If the sterile gloves are on top, you go ahead and put them on, and then everything else you do will be sterile. Okay? You will have a fenestrated drape, which of course is the drape with the hole in it. And you'll also have a poly towel, which is sterile, and you'll see how we use that in just a minute. Okay? You'll have your lubricant and your iodine swabs. There'll typically be a name tag also for your urine specimen. Please do not forget to put that on there, or the lab will not know where the urine came from. And then this container you can use to catch overflow. So that's typically what's in your kit. Let's talk a little bit about the different types of catheters. So there's a Coude catheter, which I don't have here, and that has a little bit of an angle at the tip, and that's used for people who have men who maybe have a really enlarged prostate and or some type of urethral constriction. This is just a straight cath. It's going to be an in and out cath, it's also called. And here's a Foley catheter. So the Foley catheters, while you won't be using those in the laboratory, it's important for you to know because these are the ones that are indwelling. And these have a balloon on them. So once they're inserted, you fill the balloon with water, and that's what keeps the catheter in place. And so and it keeps it from coming back out. So when you are using a Foley catheter, if you'll look at the tip here, it tells you how much water you will need to put in to to inflate your balloon. And in this case, it's a 5 ml syringe. So once you go to remove that, you just deflate the balloon, and you should get the same amount of water out as you put in. Okay? So if you only got 3 cc's of water out and you had a 5 cc balloon, that means your balloon is probably not deflated properly, and so it will possibly injure the patient as you're pulling it out. So these would be indwelling. These are straight caths. Again, in laboratory, you're just doing the straight cath. Okay, this is the kit that you're going to be using in lab, and everything is in it. It's a urethral catheterization tray, complete with the gloves, the specimen container, the catheter, swabs, the lubricating gel, and the check pads, or the underpads. This happens to be a 14 French, so 14 to 16 size catheters for women, 16 to 18 is typical for men. Okay, so we're just going to open this up. We've already done our pre-cleaning of the labia. Remember, that's called your pericare. And you're going to take this out of the bag. And when you start this process, you're going to try to keep the sterile field as clean as possible. So you'll start away from you first. Again, this is sterile, so you have just a perimeter of about an inch on either side, or any of the sides, to work with. Okay. This particular kit has the gloves in first, so let's go ahead and put those on. Just because I have a lack of room here, I'm going to go ahead and just, you'll need to practice putting on your sterile gloves so that you do not contaminate them. Okay. So we've got an underpad. And the shiny part is what's going to go to the bottom, or underneath the patient, actually. And you are going to wrap your fingers in it, like so, to go up underneath the patient so that you do not run the risk of contaminating anything, okay? Here's your fenestrated drape. You're going to keep the patient as covered as possible, and it also provides more room for your sterile field. Okay? You'll probably note that I am standing to the patient's left side because I am left-hand dominant, and so whichever is your non-dominant hand is the one that you are going to use to open the labias. But before we get to that, you're going to open up your iodine swabs. Go ahead and open it. I won't use it on our model because it will stain it. You'll open up your lubricant. What I typically will do, before I get to that, just remove the specimen container. What I will do is it's just the label. Go ahead, open up the Lydic, or the lubricant, squirt it in the tray, and then I will go ahead and put my catheter in the lube, and I'll let it sit there until I'm ready for it. Okay, so you're lubing up the tip of your catheter. So we've already opened our iodine swabs. You'll take one and just pretend this is one of our iodine swabs. So you'll open up the labia, and this is really challenging on this model here, but I'll go over this again. So once you have opened up the labias, this hand is no longer sterile. So you may not move this hand. If you lift this hand up and you don't start the whole process of cleaning again, then you will have points taken off, okay? Because you're increasing the risk of contaminating them. So you take your first iodine swab and you'll open up the labias again from the clitoris, just like we did with our earlier washing. You'll go down the labia from the clitoris all the way down to the rectum. Then you'll get rid of this particular swab. Then you'll do it again. So the next time you'll go closer to you, dispose of that swab, and then the final swab will go again from the clitoris all the way down to the anus with that final swab, and that's right down the middle. Then you'll dispose of that swab, okay? Again, holding this open the entire time. The kit is all ready for you to go if you're going to collect a urine with this in and out. I put it in my little tray. I've already had it sitting in the gel. Okay, I go ahead and then you'll insert it. Now this model is really difficult. It's not a real life depiction. Okay, so you introduce the catheter into the labia, and then once you get return, I don't know if you can see, water's coming out, you know you've hit the bladder. Okay? You will drain it until the urine stops, or the flow stops, and then you just go to remove it. You will just gently pull back, and that's how you do an in and out bladder catheterization. Once that is done, you can go ahead and remove this hand. Okay? Let me quickly show you, because I recognize that this model is really stiff and hard to work with. Again, once you open up the labia, when you clean, you'll go to the side first that is away from you, throw away that Q-tip or that swab, then get another one, do the closer to you, and then straight from the clitoral hood all the way down to the anus for the third one. Okay? These models are much easier to get the catheter into, and then when it comes to the males, same procedure, except for you'll need to lift the penis up and gently insert. If the meatus is not opening readily, just squeeze it gently. But again, once you have this hand on your non-dominant hand on the genital, you are not to remove it until the procedure is finished. Okay? With the men, you'll probably have to go much deeper until you can get some urine return. And then same procedure for removing it. Have them take a deep breath, maybe let it out, and just pull it out. On either male or female, when you're inserting the catheter, if they're tense, it can make it difficult to insert it. So having them take some big deep breaths, or even relaxing their urethra as if they're trying to pee. And you can see the urethra open up a little bit. After that's done, you can go ahead and clean your patient up. And you can use even this towel just to finally, if they have any residual iodine in the area, cleaning that and sending off your specimen. Okay? Make sure you have the patient's label on it. Let me quickly show you if you have an indwelling catheter. They will have a bag, and you will attach the catheter to it. Make sure that the bag is not, the catheter is not getting caught. There are some little adhesive devices with a clip on it, so that once you have the catheter in place, that they can have this indwelling bag.